This cream is used to treat certain skin infections. It contains neomycin, an antibiotic that stops the growth of bacteria, and fluocinolone, a corticosteroid that reduces swelling, itching, and redness of the skin. This cream only treats bacterial skin infections and will not work for infections caused by fungi or viruses. Using this cream unnecessarily or improperly can decrease its effectiveness. Now, let's talk about the uses of Neo-Synalar cream. This medication is applied to the skin only, so it's important to wash your hands before using it. Clean and dry the affected area before applying a thin layer of the medication as directed by your doctor, usually 2 to 4 times a day. Remember to wash your hands after using the cream, unless you are using it to treat your hands. It's important not to cover or bandage the area unless your doctor tells you to. Also, be sure not to use too much of the medication or apply it more often or for a longer period than directed. Using too much won't make your condition improve any faster and can increase your risk of side effects. It's also not recommended to use this product over a large area of the body or for longer than 1 week unless directed by your doctor. Make sure to avoid getting the medication in your eyes, mouth, or nose. If this happens, wipe it off and rinse thoroughly with water. To get the most benefit from this medication, use it regularly at the same times each day. And if your condition doesn't improve after 1 week, be sure to tell your doctor. If you experience burning, irritation, or dryness of the skin, it's important to let your doctor or pharmacist know. This medication has been prescribed because the benefit to you is greater than the risk of side effects. However, some people may experience stretch marks, skin thinning/discoloration, acne, or unwanted hair growth. Prolonged use may also result in other types of skin infections, so it's important to contact your doctor if you notice any unusual skin symptoms or if your condition does not improve. It's also possible for this medication to be absorbed into the bloodstream, leading to side effects such as unusual tiredness, weight loss, or vision problems. In rare cases, a serious allergic reaction may occur, so it's important to seek medical help if you notice any symptoms of a serious allergic reaction. If you experience any other effects not listed here, it's best to contact your doctor or pharmacist. Before using Neo-Synalar cream, it is important to let your doctor or pharmacist know about any allergies you may have, especially to neomycin or fluocinolone. This product may also contain inactive ingredients that could cause allergic reactions. Make sure to discuss your medical history with your healthcare provider before using this medication. It's also important to note that Neo-Synalar cream should not be used to treat an infection in the outer ear canal if the eardrum is torn. Using corticosteroid medications like Neo-Synalar cream for a long time or over large areas of skin may make it more difficult for your body to respond to physical stress. If you have surgery, emergency treatment, or a serious illness or injury, make sure to inform your doctor or dentist that you are using or have used this medication within the past few months. If this medication is used for a long time, it may have a temporary effect on a child's growth. It's important to see the doctor regularly so that your child's height can be checked. For pregnant women, Neo-Synalar cream should only be used when clearly needed. Discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using Neo-Synalar cream. This can impact how the medications work and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription or non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. Always consult with your healthcare provider before making any changes to your medication routine. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share Neo-Synalar cream with others. This medication is specifically prescribed for your current condition and should not be used for any other infection unless directed by your doctor. If you forget to use Neo-Synalar cream, use it as soon as you remember. If it is close to the time of your next dose, skip the missed dose and use your next dose at the regular time. Do not use double the dose to make up for the missed one. Make sure to store Neo-Synalar cream at room temperature and avoid freezing it. Keep it out of reach of children and pets. Do not dispose of the cream by flushing it down the toilet or pouring it into a drain unless specifically instructed. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.